What is the only disease among the top 10 leading causes of death worldwide that lacks an effective treatment? It is Alzheimer's disease. Here, effective treatment means any drug or method that can slightly improve symptoms. And even this standard is alarmingly low. Today, we will discuss the new advancements in Alzheimer's disease. Cognitive decline is a major global health concern, with someone diagnosed every 3 seconds. In 2020, over 55 million people worldwide had Alzheimer's, a number expected to double every 20 years, reaching 78 million by 2030 and 139 million by 2050. Countries with the fastest growing elderly populations include China, India, and neighboring regions in South Asia and the West Pacific. Alzheimer's is not just fatal. It gradually takes away patients' memory, cognitive abilities, and self-care skills over the years, ultimately robbing them of their basic human rights and dignity. The 2014 film Still Alice powerfully illustrates the devastating impact of this disease through the story of Alice, a linguistic professor. Why is Alzheimer's disease difficult to treat? Alzheimer's disease is notoriously difficult to treat because of its complex origins. Unlike cancer, which involves abnormal cell growth, or heart disease caused by blocked arteries, Alzheimer's is driven by the rapid decline of the brain's vast synaptic network. In healthy aging, this reduction happens slowly, but in Alzheimer's patients, it occurs too quickly, leading to a breakdown in normal brain function. This makes treating the disease extremely challenging. There are 3 main types of the disease, each with its own set of challenges. Type 1, or the inflammatory type of Alzheimer's. In this form, the immune system's inflammatory response plays a key role, initially protecting the body from infections and injuries. However, in Alzheimer's, this response becomes harmful. Patients typically start by losing short-term memory, while long-term memory and cognitive abilities such as speech, writing remain intact. Over time, long-term memory gradually declines. Type 2, or the atrophic type, typically develops about 10 years later than the inflammatory type. Unlike type 1, there are no signs of inflammation, and the inflammatory markers may even be lower than normal. However, the brain's resources to support synapses and neurons are depleted. The form is often linked to low hormone levels, reduced vitamin D, insulin resistance, and higher hormone cysteine. In some cases, type 1 and type 2 Alzheimer's can occur together. Type 3, or the toxic type of Alzheimer's. It tends to develop earlier, between the ages of 40 and 60, often triggered by intense stress. It starts with cognitive difficulties, like problems with numerical reasoning or organizing language. Patients lose both new and old memories, including life events and complex skills like playing bridge. Simple tasks, like calculating a tip, can become time-consuming, and symptoms of depression or attention deficit are often present as well. Because we can't identify the specific trigger that's affecting each patient, or fully understand what factors are damaging the brain, there's currently no single treatment that effectively treats Alzheimer's disease. The focus should be pinpointing the main causes for each individual and create a tailored plan. What's the new progress in Alzheimer's disease? The diagnosis of Alzheimer's disease is complex, involving cognitive tests and neuroimaging, ultimately confirming the presence of beta amyloid and tau proteins. Beta amyloid, first identified by neuropathologist Alzheimer in 1906, is a key indicator of the disease, while tau forms neurofibrillary tangles in the brain. Current treatment strategies aim to reduce the accumulation of these substances. One promising non-drug approach being started involves promoting the flow of cerebrospinal fluid, which helps remove these proteins and metabolic waste, potentially delaying or alleviating Alzheimer's symptoms. Additionally, companies are developing Alzheimer's risk diagnosis algorithms using big data and artificial intelligence technologies. These advancements aim to provide more accurate tools for early detection and prevention, improving patients' quality of life. Recent research from Cedars-Sinai Medical Center reveals that people can still produce new brain cells into their 60s, 70s, and even 80s. Stay tuned for practical tips for boosting brain activity.